Hello, I'm Dr. Joohee Kim, Director of the Anti-Aging Center and a board-certified family medicine specialist. Many hospitals are already equipped with advanced diagnostic tools like CT, MRI, and ultrasound. Even so, why is it still essential to get a blood test? So CT, MRI, and endoscopy are very useful for detecting abnormal lesions or tumors inside the body. However, they can't fully identify functional issues with each organ. In contrast, blood tests cover a wide range of indicators. It allows us to assess whether an organ is functioning properly, making them one of the most basic and essential methods to evaluate our health. So what can we learn from the blood tests? Recently, beta amyloid tests have been developed to detect dementia at an early stage, and tumor marker and genetic tests that assess the risk of various diseases are also being developed, and they're increasingly being utilized. Today, I'll summarize and explain the key blood test items typically performed during the obesity consultation. The first 4 items you see here are for evaluating the liver function. SGO2 and SGT are enzymes found in liver cells. And when liver cells are damaged, they leak into the bloodstream, allowing us to evaluate liver function and the extent of liver damage. ALP stands for the alkaline phosphatase, an enzyme abundant in the cells of the gallbladder and bile ducts. And when bile cannot be properly excreted or the bile ducts are blocked due to, let's say, inflammation or stones, the level increases. Here, when it reads GGTP, it's known as gamma GTP. Its full name is gamma glutamyl transferase, and it is mostly found in liver and bile duct cells. And it is an important marker for assessing alcohol-related liver disease, and it could mean various different things depending on the cases. This allows us to check liver diseases such as hepatitis and fatty liver. Glucose refers to the fasting blood sugar. HbA1c, or glycated hemoglobin, shows the average blood sugar level over the past 2 to 3 months. As many of you know, these 2 indicators are used to diagnose diabetes. And since fasting glucose is often elevated in obesity, especially in metabolic syndrome, they are important reference values in obesity treatment. Next are TC, HDL, and LDL, and TG, which measure total cholesterol and various fat types in the body. TC stands for total cholesterol, and TG stands for triglycerides. HDL is commonly referred to as the good cholesterol that cleanses the blood vessels, while LDL is considered the bad cholesterol that clogs them. These are essential tests for evaluating the risk of hyperlipidemia and cardiovascular diseases. So they're always checked during obesity treatment. BUN, which is blood urea nitrogen, and CR, creatinine, are used to assess kidney function. So while Na, K, Ca, P, and Mg, which stands for the electrolytes, they stand for sodium, potassium, calcium, phosphorus, and magnesium. High specific CRP is what helps to detect low-grade inflammation and assess the cardiovascular risk. And the next indicators, TSH, FT4, and FT3, which are the thyroid hormones, and assessing the thyroid function, help diagnose thyroid disorders. Vitamin D total tells us whether you have a vitamin D deficiency. And homocysteine helps assess the cardiovascular disease risk. Finally, the cortisol and the DHEAS evaluate your stress response and adrenal gland function. There are also additional optional tests, such as those for anemia or menopause, hormone tests, depending on the individual's need. It's surprising how much can you learn, right? The biggest advantage of blood tests is that all the disease-related indicators can be checked with just a single blood draw. At the Anti-Aging Center, we provide blood tests that include all the basic items I've just explained. Finally, to ensure accurate results, there are a few important things to remember. You must fast for at least 8 hours before the test. It's best to come in the morning for the most accurate results. So have you heard of the Theranos scandal that once rocked the US? A company called Theranos developed a device called Edison Kit. Unlike conventional blood tests requiring several milliliters of blood, they only required a finger prick and a few drops placed into the Edison device, which was then sent to the Theranos lab to detect various diseases, all just for $50. Supposedly a revolutionary solution. However, a whistleblower revealed that it was all a total lie, a fraud, and the company eventually went bankrupt. The kit gained attention because the blood testing in the US is extremely expensive. At the Anti-Aging Center, you can assess all these tests at a reasonable cost. Based on your test results, a specialist will offer personalized care plans, including lifestyle changes, IV therapy, menopause care, digestive care, and obesity treatment. They can also help issue referral letters to external hospitals when necessary. Preventing the disease before it progresses is the key. By undergoing comprehensive blood tests, you can better understand your body and receive the proper care it needs. So this has been Dr. Joohee Kim from the Anti-Aging Center. Thank you.